My name is Margaret.
And welcome to Austelll.
We're the Committed to Caring Team 2008, and our theme this year is a journey through post-acute care and rehab. Why don't you come on and join us in a residence room?
In the springtime, you know, we get soft conditions, soft fibers.
Occupational therapy is a service that, in collaboration with a doctor, may be given for patients who've had loss of function, and we would really evaluate them to see what problems they have with their strength, coordination, perception, cognition, balance, and safety. Well, we really strive to help people meet their maximum potential in function, in terms of mobility, getting around in their environment, being able to do for themselves and perform their own self-care, whether it's washing their face. With Mr. Wilkins, the purpose of our training was to have him feel stronger and comfortable in getting up from his wheelchair with safe technique, being able to balance and walk down the hall with greater endurance and stamina, and teaching him how to use the rolling walker that he was utilizing. One of the things that we try to teach is the positioning of the walker so it would be safe, braced against the wall, and to give him more support, the locking of the brakes, and the proper pivoting to sit down correctly. Doesn't that feel?
Okay, what does it look like this lady is doing?
She's dialing a telephone number.
Okay, we're going to do the same thing that we've done with these two.
All right.
We're going to put this in order. In the order that it happened. Okay, what do you think is the first thing she did?
This is she looks up the number first,
Okay.
right here. And this would be number 2 because she's dialing the number she looked up. This one would be number 3 because she's talking to her party that she reached on the other end.
I have many functions here. I focus on language, communication, voice, fluency, cognitive communication skills, and swallowing.
I'm kind of familiar with that picture.
Tell me what you see happening in the picture.
Well, he's got a problem. He's trying to sit there and figure out how he's going to get up them steps in that wheelchair.
If a patient has had a stroke, they may have trouble producing or understanding language. Basic quality of life means that we communicate with one another every day. A person who has difficulty communicating is losing out on one of the most important qualities of life. So I try to help patients regain that ability or to compensate if they've lost it by using memory aids or a communication book. A resident may think, I need to go to the bathroom, and they may have bed rails up. You or I may think, okay, I need to lower these bed rails before I go to bed. A person who's confused may try to crawl over the bed rails and end up falling and hurting themselves. These cards enable the patient to begin to think in a sequential or logical manner so that in real life situations, they're able to apply the same skills so that they will be able to look at the rails and think, I need to let these down.
In physical therapy, Mr. Wilkins came in the door tired, weak, had poor balance, had poor endurance, wasn't able to even walk outside of his room without assistance, and he's made fantastic progress in all these areas.
And we work with people to strengthen them, to get their ambulation skills back, get their balance back, get their transfer and mobility skills back, and hopefully, and in many cases successfully, rehabilitate them in order to return home or to maximize their mobility here at the facility. So we work a lot with strengthening the legs, improving the balance, and again, choosing the right assistive device to meet their needs. Well, a lot of times we'll work on things like standing balance, say doing an activity in a standing position, which is very functional. You know, a man, we may work on them shaving in the mirror, standing up. We may work on them putting things up in a cupboard. And then if we don't have that right in front of us, sometimes we may work on kind of making the scenario, such as you'll see with Mr. Wilkins, where he's going to be placing pegs from a lower position to a higher or higher to lower.
And that's really difficult, but it's a very functional activity. Even reaching up for adjusting the shower head or shampooing or something like that. A lot of times people tend to fall backwards.
The physical therapist must follow a doctor's order and evaluate each resident. So when they come in the door, we're customizing their treatment plan and establishing the treatment plan with the patient. We don't use a cookie cutter kind of procedure with anybody. Well, from the minute they wheel in on that stretcher, they're getting welcomed down the hallway. Their room is prepared with love and a prayer.
I believe in one word, it would be respect. Because when the residents come in, we don't just treat them as a patient, we treat them as a person with individual needs and wants. And we know that everyone is different. Everyone has to be motivated in a different way. And we strive to find what motivates that resident, what is going to make them want to get out of bed in the morning and come to therapy.
And generally, therapy, nursing, all the team gets in there and introduces themselves, and I would think they'd be feeling quite well cared for instantly.
We don't go in and say, oh, you have to get up. We say, good morning, how are you doing? Are you ready for therapy today? And if they say no, we say, why? What's going on? We make them know that we care for them as a person. We care for their well-being, and ultimately we want the best for them.